It's Mark from Top Local Lead Generation. We're here with Dr. John Pidutti of Springs Eternal Natural Health Clinic. He's a doctor of naturopathy in Vancouver. How are you doing today, Dr. John?
Doing great. Thanks for having me, Mark.
So we're going to talk now about chronic fatigue syndrome and what are some of the important points to be aware of with chronic fatigue.
Yeah, chronic fatigue is another one of these conditions that's very complex. And I use the word chronic fatigue syndrome. There's actually a lot of debate on what wording, what should we call the condition. And so, there's some people who won't approve of that label, but in the end, to me, it's really more of someone who's experiencing extreme fatigue, and we're looking at the root causes with this condition. It's a condition where, again, you need to be with someone who has experience, because in the traditional practice, a doctor is going to say there's just not much we can do for you, where there is a lot that can be done. And it's something, though, that there's thousands of claims out there, all good intentioned, but really the best results come when someone figures out what are the root triggers for them. And with chronic fatigue, this is where we actually need to do a lot of testing. There's blood work that needs to be tested. We'll often do stool samples to really figure out what's going on in the digestive tract. It's something that there's so many tests that we need to rule out all these other possible conditions. And from there, then we'll get an understanding of what's causing the symptoms in you. Of all the patients I've seen, we've been working with Springs Eternal since 2004. And I've seen a lot of chronic fatigue over those years. And with that, it's interesting. There's no one category of people who have chronic fatigue. There's classes that appear in that. And some people, it seems that, for instance, organism imbalances in the body are huge for some people. And other people, it's more a picture of they've been burnt out, their hormones, the stress, all those factors have fried their adrenal glands, or their energy is wiped because they've just been under chronic stress for so long. Often that sets up for the other, or vice versa, but there's no one person that you can just say, this is it. And we really need to understand all the factors involved.
So is there one common cause that you've seen often when people have CFS syndrome or CFS?
With chronic fatigue, we see a lot of digestive problems, and that's one common thread that we'll see through the condition. Is usually there's a history, maybe of irritable bowel syndrome, or maybe just some undiagnosed condition where some people, it's even as severe as colitis, will often also have it. But usually there is some inflammation going on in the digestive tract that's leading towards inflammation that drips into the body, and over time your body gets a little burnt out dealing with that. That'll also lead to imbalances again in the microorganisms. Another interesting factor is we'll often see a past history of exposure to Epstein-Barr virus, which is mono, and again, we can't say it's causative, but we see this correlation of most people that I've treated with chronic fatigue. There's some history of viruses in the background. And again, this is where we do all the testing to figure out what are these little factors that could have thrown the immune system into this haywire state. And then the immune system, when it's in haywire state, throws off the nervous system, and that just starts to snowball, and eventually people are burnt out.
So are there any examples of people that you've helped?
I'll give you a couple examples. One is more complex and one would be more simple. The simple one we'll start with was just someone who they got a virus. They had gone on a trip, got a virus, weren't sure what it was, got sick, and they'd had a history when they were younger of Epstein-Barr, interestingly enough. But this time they had just gone, I think it was to Mexico, came back, were sick, and then just could never recover. So they were going to work, they were just fried. Eventually they had to take sick time off work. And in this case, we did the whole picture. We assessed all the causative factors, and we looked at, there was an imbalance in microorganisms in the body, especially in the digestive tract. but there was also some imbalances elsewhere. And we did some treatments that were gentle, so we changed some diet, and that can be scary for a lot of people. It wasn't too complex. We did some dietary changes, cleaned up the digestive tract. But then we also did some symptom relief, and we look at intravenous vitamins when we do that. High doses of intravenous vitamins that rebalance the immune system, that activate certain things like natural killer cells to fight off infections. Really high doses of antioxidants just help to repair and oxygenate the body. And in the end, within the first month, this person was life changed, back to work. So that's the more simple. A more complex is actually doing the same thing, same assessment, same treatment. It just lasts a lot longer. And we also had to involve looking at mind-body situations, because with the mind-body, there's stress just from the condition, and then sometimes there's causative patterns in the nervous system that lead to the imbalance in the way the immune system fires. It's an interesting thing that I tell a lot of patients with chronic fatigue, where the immune system and the nervous system, you almost can't separate them. There's a field called psychoneuroimmunology, and it's basically where they say as soon as one's reacting, the other's immediately reacting. And with this condition, you're having an imbalance in the way the immune system balances the body. It's either over responding or under responding. And so when you combine those two and you look at all these factors together, you can start to balance it out. Instead of having these big peaks, you can get a more appropriate response. And when that response happens, you feel much better. So I'd say that those are some examples. And in the end, if someone just would seek out somebody who has lots of experience with it and lots of experience helping people understand the root causes, they can get some great results.
So would you like to summarize?
Yeah, that basically would be my kind of takeaway for people, is really just find somebody who has the experience with not only diagnosing and running all the tests, but has the experience with looking at a person, an individual, and seeing how their body is breaking down. And when you see how an individual is breaking down, then you can give specific treatments. So, you hear of all these treatments for boosting the effectiveness of the mitochondria. Well, that may be beneficial for some people, but that may not be the root cause in other people. And so that's where you really need somebody to assess you individually. And then we can kind of tailor a program of, what supplements or what support would be best for you. That would be it.
If you want some help with your chronic fatigue syndrome, check out springseternal.com or give them a call to book an appointment, 604-737-0012. Proven results for chronic fatigue from Dr. John Pidutti and Springs Eternal. Thanks, John.
Thank you.